long-term care is assistance with activities of daily living that I have listed here. So if medically, to determine your need for care, you normally need to need assistance with at least 2 of these activities of daily living that you see listed on the screen: eating, bathing, dressing, transferring, toileting, continence. If you need assistance with at least 2 of those, it's really deemed as needing care. Or if you have a cognitive impairment issue, and this is really becoming more common than a physical disability. So if a person is developing Alzheimer's disease or some other memory issue, that can cause a need for long-term care that actually can be pretty worrisome, because a physical disability needing help with a couple of activities of daily living, normally the care doesn't go on all that long. It normally lasts anywhere from 3 months to maybe 2 years. But a memory issue on average lasts for 8 years. And that's where long-term care becomes a real worrisome risk that needs to be planned for ahead of time. Because if it goes on for the average of 8 years, that's a long time to be spending tens of thousands of dollars for a need for long-term care. Go ahead with the next slide, Tammy. Thanks. So most of us who have lived at least till mid-age or after know someone, parents, aunts, uncles, grandparents, who have developed one of the causes of needing long-term care. I've been mentioning Alzheimer's disease or other forms of dementia. Another one is Parkinson's disease. My father developed Parkinson's disease at age 62. He really didn't need care until his late 70s. So he was fine with medications and therapies for about 15 years. But the last 3 to 4 years of his life, he needed assistance. And my mother was actually able to keep him at home during that entire time. He passed away at home. But Parkinson's is one of the big risks when it comes to long-term care. Another one is strokes with residuals. So if someone has a stroke and they end up not passing away from the stroke but needing assistance, that can cause a need for long-term care if it's something that you're not going to get well from. Heart or circulatory conditions, particularly if they're combined with diabetes. Medical science has learned in the past decade or so that circulatory conditions or heart conditions combined with diabetes can lead to memory issues. And frailty due to living a long life. And this is becoming more and more prevalent these days. People living past age 85 or 90, and their bodies or minds simply wearing out the last few years of their lives. Next slide, Tammy. So we hear about this often. We're living longer, and it's really becoming a cliche. Life expectancy has dramatically increased over the past 5 decades because medical science continues to find ways to keep us alive. Not necessarily in quality of life either, but this can be a big problem for our families if we live a long life and end up needing care. I'll mention more than once on the presentation here that we really plan ahead for our families, not necessarily for ourselves. Particularly if you develop something like a memory issue, you may not even know that you're needing the care, but your family definitely does. Next slide, Tammy. Because this is really the bottom line on really what we're trying to educate people about. The impact of long-term care is not really about you, it's about your family. And as Justice mentioned earlier, I've been in this business for 30 years, and I've heard hundreds of times over the years that if I have a need for long-term care, I'll just take care of that myself, implying that they're going to kill themselves. But we really know that that's not going to happen. What's really going to happen is that our family is going to take care of us if we end up needing long-term care. They're not going to let anything happen to us. Next slide, Tammy. So when I say family, who am I really talking about? Well, if any of you have noticed caregiving taking place, you've noticed that it's always the female family members who do the caregiving. So it's normally wives, daughters, and daughters-in-law taking care of husbands, fathers, mothers, and mothers-in-law. And the reason for that is women are more nurturing than men. We're all working on it, ladies, but we're not there yet. We're not as nurturing as you guys. The man in the family normally tries to take care of the logical challenge. In other words, maybe the money part of it. But the female family members are the ones that are really going to end up doing the caregiving. And this can cause a lot of times sibling rivalry because it's sometimes caregiving is being provided by one of the family members more than the others. And we've seen this over and over the years, that this is one of the major reasons for having a plan for long-term care in advance, is a lot of times it can alleviate some of these problems. Developing a plan while you're well and you have all your cognitive faculties is the best way to plan. Really, that's why you have a financial advisor. You want to plan ahead for your future, and long-term care is one of those areas that you need to plan for. Next slide, Tammy. Now, this is another myth that I want to dispel, and that is, if you need long-term care, you'll go to a nursing home. And that is not true for most people who plan ahead. The reason that you hear so much about nursing home care these days is the federal and state government pay for long-term care through the Medicaid program. Not to be confused with Medicare. Medicare is the health insurance program for people turning 65. The Medicaid program is a means-tested program available to people at any age as long as they qualify for it financially. In other words, as long as they don't have the means to pay for long-term care. So anyone in America who has a need for long-term care but doesn't have the money to pay for it will be taken care of through the Medicaid program. And fully half the people who need long-term care can't afford to pay for it on their own. And so they rely on the Medicaid program, but they have to go to a nursing home. Medicaid does not pay for care in an assisted living facility or home care. So this has become an issue of people believing that they need to go to a nursing home if they need care. But that's not true. I'll give you an example on the screen. This is actually my grandfather, this example. He owned a business that he ended up really losing because of needing long-term care for memory issues. He needed care for the last decade of his life, and none of that care, well, the last few months were in a nursing home because he developed a medical condition. But almost all of that care took place at home or in an assisted living facility. Next slide, Tammy. Because long-term care is a continuum of care in most cases. Again, in most cases, if you pay for it on your own or you pay for it in a way like long-term care insurance, in a way other than the government taking care of it. The place of choice, of course, is home. You want to be able to have care at home for as long as possible. If that no longer is possible, And a lot of times people's condition worsens and they can't have care at home, becomes too expensive or too hard to manage at home. You move to an assisted living community or an Alzheimer's facility, which, by the way, is the wave of the future in long-term care delivery. You see these assisted living facilities being built up all over the place. There's really more supply right now than demand for these facilities, and it's really helped contain the costs of long-term care over the past couple of decades, because these facilities need clients, they need customers. And like I say, there's more supply than there is demand for those right now. But it is the wave of the future for long-term care delivery. Most of us want to stay at home, but a lot of times it's not possible. The last resort is nursing home care. And if you have a plan for long-term care, the only reason you'll go to a nursing home is the same reason my grandfather had to go into one for a few months at the end of life, is he developed, and you might develop, a medical condition that requires 24-hour-a-day doctor supervision. Now, the reason that I make this important distinction is that when you plan ahead for long-term care, you benchmark a cost number with your financial advisor at FSG. So, for instance, you say, all right, the average cost of long-term care is $7,000 a month. And that's not a completely arbitrary figure. I'm pretty close with that figure, but it may be a little bit less or a little bit more in your area. But you benchmark that number, and we don't want to include costs for nursing homes equally as costs for home care and assisted living, because you're not likely to need a nursing home for all that long. And if you emphasize nursing home costs too much, as most people do, then you're benchmarking a number of maybe $11,000 or $12,000 instead of a lower number that's more realistic. It could really be compared to thinking that you need $5 million and it's going to take you till 80 years of age to accumulate that much money, when you really needed $2 million and you could have retired at age 60. That's a really silly example, but we really want to benchmark the right numbers when it comes to planning for long-term care, or the simulations that your advisors at FSG run won't be accurate. So the way we plan for long-term care is analyze the implications of the 4 ways to pay for long-term care. These are the only 4 ways to pay for long-term care, with the first 2 not being very positive and usually being crisis plans. In other words, a lot of times a plan wasn't developed at all. It just defaulted to either a family member taking care of you or the welfare program. I mentioned Medicaid earlier. It's called Medi-Cal in California, but in the other 49 states, it's called Medicaid. The other 2 ways to pay for long-term care are much more positive. You either rely on your own assets or you rely on long-term care insurance. Now, a 5th way would be a combination of those options. Not welfare, because if you qualify for welfare, you're going to be taken care of. But you could say, we need to transfer some of the risk for long-term care to an insurance policy, but we can handle some of the risk on our own. And this is where the simulations that FSG can run for you come into play. It really determines your at-risk amount for long-term care. So if we find out that you have enough money to pay for care on your own and still reach your other financial objectives, then you can avoid long-term care insurance and all the negative things about insurance, including paying the premium, having to deal with an insurance company at claims time. Insurance is important, but we don't want to own insurance that we don't need. So no one of these resources is best for everyone. All of them have pros and cons. I will tell you that fewer and fewer people these days are relying on long-term care insurance for a variety of reasons. It's becoming harder to obtain. In other words, your health has to be better than ever. It used to be fairly easy to obtain long-term care insurance. You could have some fairly major health problems and still be able to obtain it. That's no longer the case. You have to be in very good health to be able to get it. Another reason is the premiums have gotten more expensive than they were in the past. And so when you work with your advisors at FSG to determine whether or not long-term care makes sense to you, a lot of times you say that it doesn't because it's just not a good economic value. The premium compared to the benefits are not like they were in the past. Now, there's non-financial implications to your plan, to the plan that you develop for long-term care. And this is where we can really come into play, helping you collaboratively with your advisors at FSG. They handle mainly the money part of it, but we can help you determine, for example, whether or not your odds of needing long-term care are higher or lower than the general population. Now, how would we do that? We do that by really doing a mini analysis of your family history. If you have longevity in your family, in your genetic family, living past age 85, or if you have family members who have had memory issues, whether they needed care or not, your odds of needing long-term care are higher than average. Now, that doesn't mean that you'll buy long-term care insurance. It does mean that you're likely to benefit from long-term care insurance more than the general population. So you may discover that even though you've determined with your advisors at FSG that you really could take care of it on your own, you might want to rely on long-term care insurance, at least partially, if you discover that your odds of needing care are higher than average. So we can help with some of the non-financial implications of a plan for long-term care, while your advisors at FSG can help you with the financial implications. Okay, Tammy, next slide. So we really want to ask ourselves what our plan is. And it's really similar to other aspects of financial planning. When you reach out to retirement age, you're simulating, what are my investments going to look like? What are my expenses going to look like? We really do the same thing with long-term care. Your advisors can simulate, what if you needed long-term care 20 years from now, or less, or more than that? How would that affect your overall financial objectives? Your objectives to leave an inheritance, or your objectives to take care of one another, whatever those objectives are, would you be able to handle a risk of X amount of money? Let's just pull out a number here of, say, $500,000. That would be care costing $80,000 a year for 6 years. If you could handle that on your own without a lot of negative implications to your family members or your financial objectives, then you might want to just self-insure this issue. In other words, plan to rely on your assets. The really important part of this exercise is to learn about this issue and work with your advisors to plan ahead for it, which really means spending maybe 4 or 5 hours over a period of 4 or 5 weeks, really thinking this through and making a decision one way or another about what you want to use as your plan for long-term care.